Doctor. Nice to see you.
Good morning, Liz. Great to see you again.
So let's talk about antibody testing. We're talking more and more about this recently. This is basically testing to see who has already been exposed and who or affected. Is that right?
Yes. So there's antibody testing tests two things. It tests your previous exposure or immunity. So if you've either been vaccinated or exposed to a disease, you're going to have what are called IgG antibodies. And then there's another type of antibody that we also test usually in the same test, called IgM antibodies, that tell us if you're in the early stage of a current infection. So that an antibody test can really accomplish two things for us. It can tell us who's actively infected right now in this moment and who has been either infected or exposed in the past. And the tests that we're all hoping for and wanting to get on the market in wide distribution are these 15-minute finger sticks that come back in a 15-minute turnaround.
Okay, so this 15-minute test it's not out there yet, or it is in small amounts?
So that's a good question. So what happened about a month ago is the FDA did a fast-track emergency authorization to allow a lot of these experimental tests and companies to put them out on the market. However, there was no scientific oversight of the quality of the tests. So now what has happened is that there are thousands, if not hundreds of thousands of these out there of very questionable quality. So that's the concern, and none of them, they've all been technically FDA approved, but nobody knows the quality of the tests, and no one can guarantee them at this point. So what we really are waiting for is for some of the bigger lab companies like LabCorp and Quest to do the rigorous scientific trials to make sure that these are truly valid products that will give us the results we want, because it's useless to have all these tests out there and not have quality and validity. Otherwise, we're flying blind.
Yeah, and I mean, it can give anyone really a false hope that they're not vulnerable anymore to the virus, right?
Exactly.
Now, you mentioned we're waiting on these big lab companies to, go through these scientific trials before they come out, in mass production with more of these antibody tests. How long, though, does that take?
Well, I was talking to a LabCorp executive yesterday, and I was told it's going to be a matter of weeks, a couple of weeks, I'm hoping, which is a better answer than I've had in a long time. So I'm optimistic that once they can get those out there, it's going to really move us significantly forward in being able to reopen once we have all that data. The problem is that if we don't have that information, it's just really tough to know what to how to distance ourselves and who can do what. And then the other thing too is it has to be affordable for everybody and accessible to everybody. So having these pop-up tests or pop-up clinics that are doing testing and charging $150 for people to come through, we have no idea if any of those tests are even valid. And that's not really fair to the general public that can't necessarily afford that.
Yeah, I was seeing footage of one pop-up testing. They had a tent, and I think it was like a drive, kind of like you pull up, and they were doing the finger testing. I think it was finger testing, but they were charging about $80 to a little over $100 for this antibody test that, like you said, we don't really know if they're accurate, because although they might be FDA approved, we're still waiting for like the bigger lab companies to really come up with a better type of test. So right now, it's kind of a wait and see situation. How are you guys holding up there at Kind Health Group with people being infected by COVID-19 or showing symptoms?
Well, we're in Encinitas, and we do concierge medicine and telehealth, so we haven't had a lot of, we aren't seeing really many patients in our office unless I really need to see them, and I usually just go in alone to see them so as not to expose my staff. Mm-hmm. And then additionally, we take care of most everybody through telemedicine and telehealth, and we're still taking new patients. So if anyone is interested, they can go to our website and sign on for a telehealth visit. And we just want to help as many people as we can. Mm-hmm. But it's been really hard for everybody in the community.
Absolutely, and as we wrap here, Dr. Nanos, going back to the antibody testing, once it is widely available, would you suggest everyone get a test?
Yes, every single person in the United States should get a test once we get it, once we have a valid, reliable test. And that will give us so much more information as to where we stand on how much this disease has really penetrated into our communities, because right now we really have no idea.
Right, Dr. Georgine Nanos, always great to see you. Thank you so much for shedding some light on antibody testing.
Thank you, Liz.
With unemployment rates